It's important that we speak truth to power, powerful individuals, powerful institutions, because truth paves the way to making a better solutions for tomorrow. Hi, my name is Christina Yongue, and I am an assistant professor at the University of North Carolina in Greensboro. I work in the Department of Public Health Education. Well, I got into the work of racial health disparities around 2006, 2007. That is when I found out that my mother had breast cancer. And her being a Black woman, it was very devastating to us that we might lose her. And she did pass away from breast cancer. And at that time, I was working in another public health field, working with adolescents and preventing them from getting involved in risky behaviors. And so while my mother was going through this, I definitely wanted to work more to help families that were impacted like mine has been. And so I found an opportunity through one of my former professors. He let me know about this job opening to work on a racial health disparities project that dealt with breast cancer. And one of the interesting things about this position was that it was a liaison position. So I had to have community relationships and knowledge and a knowledge of working in the academic area. And so as a project coordinator for that job, I was able to grow and build and work directly on this personal issue that impacted my family so much, but it impacts so many women. There are more white women who are contracted with breast cancer, who are diagnosed with breast cancer, but there are more Black women who die from breast cancer. Through this research, I've learned a different approach to addressing this issue, because there have been several studies over time addressing racial health disparities, but we still see a difference in outcomes by Black and white women. And so what this group, this team that I was able to work with, called the Greensboro Health Disparities Collaborative, they have understood the problem as an institutional problem. So instead of looking at the individuals and their behavior and lifestyle only, let's look at the institutional level and systems changes. And so because of that, we worked together and we developed some strategies to go forward to affect change in our local medical systems, and we were implementing that. So having worked with them for 10 years taught me a lot. And so because of that experience, I can go teach others about it. So now at UNCG, I'm able to be at the school where my mother graduated from, and I'm working in the Department of Public Health Education, and I'm able to teach a class called Race, Ethnicity, and Health. And I'm really thankful for that experience, because it allows me to talk about what I've been focusing on for the last 10 years and help empower another generation to be leaders in this area too. So I'm excited about that. I'm also working with students that are going out and doing their first internships in public health. So that's so rewarding, because I get to see and hear from them when they have really meaningful experiences working with the populations that they love and that they serve.